Welcome to Consumers Doctors channel. Today's focus is on covered California. Covered California. I just enrolled into the covered California and exploring the options for me for the healthcare coverage. Actually, the website looks pretty impressive. I like it. How to apply. They give you all the instructions, and you can review all the options, and you can have a coverage based on. And also, they tell you how to apply for Medi-Cal and the dental coverage. Again, they have so many options for Medi-Cal for children, Medi-Cal for individuals, Medi-Cal for pregnancy, Medi-Cal and CHIP, and medical access programs. It's pretty elaborative in the sense they also have bronze plans. Bronze plans includes, that's a beauty, includes bronze plans are non-HDHP accounts. Bronze plans are non-HDHP accounts. Is the bronze plans right for me? This is where I have to differ. When you can give you a certificate of guaranteed coverage through a public-private partnership, you don't need to have a bronze plan. People, health review board. I wish California looks into it because California is very progressive. I understand that, but they need to really look into the benefits for small businesses, especially under 50 employees, and they should focus on solo or small mom and pop they can focus on that and try to see how you can improve the access to healthcare. You don't need this non-HDHP account, folks. This is what, even the Medi-Cal is not necessary. If the Medi-Cal is nothing but basically state is pumping the money into the Medi-Cal, and I wish they collaborate with public-private through a public-private partnership. Public-private partnership goes a long way, folks. They can even include workman's comp. They can scrap the whole entire Medi-Cal program because not many providers want to take care of the Medi-Cal, and I would like to see a certificate of guaranteed coverage through a health review board and determine it's a private insurance, folks. It's the private personalized health insurance. If state California determines that this individual qualifies for the certificate of guarantee, give them and fund it through a public-private partnership rather than state taking the entire responsibility. This is where I want to focus on. It's HDHP accounts are good, but they're putting this is like a third class. They don't tell you it's like a county. Medi-Cal is nothing but a third class program. I don't like when people are segregated into Medi-Cal, Medicaid, bronze. I don't like it. I just don't like the class system. They don't say it. It's discreet. But when you say bronze, silver, gold, you basically say first class, second class, third class. Why do that? Why don't you just give them a certificate of guaranteed coverage through a public-private partnership and pay for it? And incentivize them to have health HSA accounts, incentivize. You can even incentivize in the lower income bracket folks. People can people will love to save money into the HSAs. They want to put money aside for their health. Even in the lower socioeconomic group, we underestimate the Americans. People in the lower socioeconomic, they work hard. They they are responsible. If you give them the right tools, we are not asking for a handouts, folks. We are not asking for a. Give them the right tools where they can save and put money aside into HSA. They can use those funds for the future healthcare needs instead of totally dependent on the government or public option. Why can't you give them the option of giving them a certificate of it is like a private insurance, private health insurance, and which will, through HDHP accounts, they can save money, lower the premiums, put money aside into HSA accounts. I wish they had this HSA account incorporated somewhere. And there's a silver 70, silver 73, they have silver 87, 94. I don't know all the intricacies. I'm sure different levels of plans, and they have gold coverage. And obviously, gold coverage, you have to pay co-pays, deductibles, co-insurance. This is where we need to reform the healthcare insurance industry. This is where we need to Affordable Care Act come into fold. Everybody should have a guaranteed health insurance. Everybody should have guaranteed health coverage, major medical, guaranteed catastrophic. All these HP accounts should incorporate all this and also have a pre-existing illnesses. But they should make sure that everyone is entitled to HSA accounts, Health Solutions Advantage accounts. HSA accounts are, you can put money aside for a lot of people might say, hey, these people don't have money to save. I don't believe that. I don't believe that for a word. When you give them the options, let them decide. If they want to be in the government door, public-private sector door, and a certificate of guaranteed coverage, it's up to them. But give them the tools what they need for the HSA accounts. Make sure it's available to them, so that way, even if it's $100, even if it's $50, it goes a long way, folks, for these people. And it gives them some type of a personal responsibility into their health. Right now, as long as somebody is giving a free care by Covered California, they don't have to take care of anything. They don't have to be personally responsible. They don't have to look for a job. They don't have to look for anything when you have an options. But when you have a certificate of guaranteed coverage by the Health Review Board through a public-private partnership, they have to be responsible. This is where I'm trying to tell you. Personal responsibility, we need to teach them. Some people are not used to it. When you say you need to fund this healthcare clinics, what the healthcare clinics' primary intent is advice regarding the abortions. First of all, it amazes me if a person has a Medi-Cal card. If they get married, they will lose their Medi-Cal card. That's so sad. They shouldn't put that clause. You should either you give them the coverage. Don't discourage them from getting married. Does it make you need to encourage them to be people living together for a convenience and having babies and abortions. It's so tragic. They have dreams too, but these stupid representatives, I don't want to blame anybody here. These representatives, They have no idea what they are doing. They're encouraging to get aborted. They are encouraging them to have a free abortion. You should give them the personal responsibility tools what they need. They need to be personally responsible, and give them those tools. We are not begging for hangouts. Nobody's begging for handouts, man. This public option thing is nothing but a handout. They just want to encourage people to be on the control. That's the control factor. They want to control them. This is what it's happening in urban areas. People have government jobs and county jobs and on Medicaid. That's what they're doing. They just want to control this entire segment of the population. Why can't you teach them the right thing? Give them the right tools. Even they're not asking for handouts, but you're giving them the handouts so you can control them. That's what I don't like it. This public option needs to go away. Public option is nothing but a control. That's what it is doing. Give them a public-private partnership tools, though everybody be responsible. Our obesity will be solved just like that, because they don't focus on physical fitness and food. One thing, the depression is a common factor. Depression leads to obesity. We all know that. Every time people are depressed, the only option is they keep eating the wrong food. This EBT cards and food stamps, it's a good idea, folks. It's a good idea. But I don't know. I would just tell them, don't buy the meat products. Buy vegetables and healthy food. Just give them the EBT card, give them the food stands, but don't let them buy this sausages, beef, and all this bad food for you. And that's all they do. They can eat a lot of lentils. They can eat a lot of nuts, raw nuts. If they're hungry, they can have vegetables. Nowadays, aquaponics. I would love to teach these guys aquaponics. Aquaponics is the way to go. You grow your own vegetables at home. You don't even have to go to the groceries. Aquaponics is the way to go. I want to do it. I love to do aquaponics, grow my own vegetables. I can pluck it and eat. There's no organic stuff there. It's good for you. Good for you. Teach them these values. I wish our representatives focus on giving the right values, telling them, don't give them wrong tools, give them the right perception, how to live happy, how to individually be responsible. This marijuana, so-called this cannabis, I'm not sure how good it is doing. I know people need cannabis. I understand for old people, they have health problems there. But it's being misused, man. It's being misused, cannabis. You want to cut down the crime, there's a way to cut down the crime. But don't encourage people to have cannabis. Youngsters, why do they need cannabis? Youngsters. No wonder, Democrats control the states, Colorado, Mecca for cannabis. Now they want to make California into cannabis. Washington State, Portland. No wonder. These people, they go and vandalize hard-working Americans' stores, mostly owned by African Americans, mostly owned by Hispanics. These are hard-working folks, and you go and vandalize them. They have no personal responsibility. These assemblymen, senators, congressmen, they're not teaching these folks the right values, man. They need to teach these folks right values, how to live a happy life. Depression is a common problem in the society. That's what it leads to the obesity. Half of these people have depression because they're they're in the lower socioeconomic. For them, only let out is eating bad food. Anyway, this is Consumers Doctors channel. Thank you for joining. We'll love to hear your comments, man. We'll love to. I want to get into this podcast, YouTube podcast. So I'm trying, and also I'm going to make some comments. If you have comments, please share the comments. And I want to expand my audience so badly and teach them the right values. If our representatives are not doing it, we need to teach folks right values. I wish we all can do that. We can do that. I think America is better off. It's better off. It's not the government is going to solve the problem. Government is the problem. Government has to give solutions, not the problems. Government is the problem by giving these public options. Everywhere you go, you turn around, there's a public option. But that is destroying the societies, destroying their morals, destroying their core values, man. Core values. Give them the tools. Nobody is asking handouts. They're asking for the right tools. Provide them the right tools. Again, thank you for joining. We'll see you in the next segment of Consumers Doctors channel. I love you guys. I want to see some comments and share. And touch the bell, touch that bell, and share it and subscribe it. Thanks again.